Good morning, everybody. Sadly, we had another Albany County resident die overnight, a man in his 70s. My heart goes out to the families, my condolences, my prayers goes out to all 62 families in our county. And if everyone can take a minute, send them a prayer, condolences, I would appreciate it. These are difficult times. And as we get used to the new world we're in, this makes it harder for people to move forward. And again, we're there for the families if they need our support. And again, our thoughts and prayers are with you. Also, I just want to say to the frontline workers, thank you for what you do day in, day out. Can't do it without you. And to everyone staying home and doing the right thing, we can't do it without you. We sure as hell can't open up without you doing what you're doing. So just remember the new norm. Reimagine. 6 feet apart. No more hugging people other than your family, and wear a mask out in public, clean your hands constantly, and cough into your arm. So as of today, we have 1,386 positive cases of the coronavirus in Albany County, with 881 people under mandatory quarantine. That's down by 32, which is good. And we're only up by 11 today, which is also good. We have 19 people under precautionary quarantine. That's up by 2. So again, our numbers are looking good. At Shaker Place, status quo, but I do want to report, I'm pleased that we have 8 residents who tested positive now are fully recovered. And out of the 15 employees who have tested positive and remain out, 12 others have been cleared and returned back to work, which is also great news. We have 3,471 people have completed quarantine. Of those, 867 tested positive for the virus and have recovered. That's up 30 from yesterday, which is also great news. We now have 31 people hospitalized with a hospitalization rate of 2.23% of those who have tested positive. And yesterday, as everyone recalls, is at 2.25. Other great news. We have 7 people currently in ICU. Stays the same as yesterday. So for the 5-day average, we're about 15.4 new positive cases each day. That's the 3rd day we went down, which is also great news. It helps us step towards that reopening. But again, with all the testing that we've been doing, aggressively testing, it's good news because it tells Dr. Whalen and I that you have been listening to us for these will be 9 weeks tomorrow, actually, for these last 9 weeks, and people are doing the right thing. And when we do go to open up, and I'll talk a little bit about that later, we have to do it and still be cautious, and with that, we have to do it in the right way. But most importantly, when the weather breaks this Saturday, and I know Saturday is going to be nice, and Sunday, we got to keep our distance. I know people are going to want to get out and walk around, but we have to keep our distance. But as always, we continue to do our mobile testing. Today we're in Queens. So the number for people that want to do mobile testing is area code 518-465-4771. And again, you can get the full schedule on our website of where they're at and what times. Also, testing for essential workers have been expanded by New York State. You can call, and this number is important for the essential workers, 1-888-364-3065. That's 1-888-364-3065, or go online. And again, for our Colony site, you need to register online. That's the only way they're doing it, at riteaid.com. Also, I mentioned yesterday the Priority 1 Urgent Care in Gilliland. They're doing an antibody testing as well, so you can schedule that appointment to go there. If you have the signs and symptoms from before and you want to be tested to see if you now have that, please do that. The other thing I just want to really kind of talk about, and it's going to get into about the reopening, and I'm going to talk about the slides and all that. I read an interesting article today in the TU, and I believe it was Sherry Campbell, and if I said that wrong, Sherry, I apologize. But it was an interesting article on education about reopening, and some of the things the schools will be looking at, and like masks, 290 million masks a week that these universities and schools will need across the nation. But one of the things that was kind of ironic, I took a phone call from Faith from Mildred Elliott today, And we were talking, and she's concerned because her school's been shut down, and she has a school in the Bronx. Why is that important? She trains our certified nursing assistants at our nursing homes. We actually get a lot of students from there that come out to our nursing home. And if she can't reopen and she can't get people back in the, into a classroom setting to make this happen, how do you get new people in, fresh troops, so to speak, into the nursing homes to give relief to the hospital workers, to the nursing home workers, to the people that are really going 7 days a week, multiple hours a day, no time off, because again, if someone gets tested and they have the coronavirus, they're taken out for 14 days. And that really hurts the underlying of trying to take care of patient care. And when I was talking to her, some of the issues she had, and I said I would bring it up to the control room today, was the fact that she goes, well, I have students that don't have web cameras, they don't have the access they need to take the entrance exam, and I want to bring them into school. There's probably like 6 of them, spread them out, they won't be in the same classroom, so they can take this exam. And I said, listen, I'll bring it up and see what we can do. But as the Department of Education has stopped this because it's more hands-on learning and that type of stuff, well, that's what they're going to be doing in the hospital's education department. They have to look at it. That's what they need. They need to get in there. They got to learn how to wear PPE. They have to learn how to do it safely. What better way than in the classroom environment? But we need them troops in our nursing homes, and especially with the new DOH guideline of testing workers twice a week. Where are we going to get people as they come up, and if they're positive, and where are we going to get the fresh troops if we don't have people to bring in to the ranks and file? So this is something they have to think about. I know that, listen, we're changing the game plan, and that's fine, but when you change the game plan, you have to change the approach to this also and rewrite the guidelines of saying, hey, look, it's essentials. These are essential workers. And if they're having that issue at this school, how many, like I think in Maria College, that trains all of our RNs and our LPNs, we need them. We need these essential workers, and we need to relieve them to get them into hospitals where they're needed as this continues on. So it's something people should really read that article today. It's about kids with disabilities. We have 40,000 preschoolers from age 3 to 5 that has disabilities, and we have 482,000 school-age children that have disabilities that they're falling behind. And we need to address that issue too as we go forward. It's a really great read, and hopefully people take the time. But again, I'll say this to the Monday morning quarterbacks. Comment with some solutions to the problems. We don't need to hear, whining. We need to find out how we can bring people back. And if you have a great idea, or how we can start teaching these kids or get the kids with special needs back in, please, by all means, speak up. To the teachers out there, speak up, please. This is all new to us, so we have to do this together. So after yesterday's briefing, we found out that the region is now meeting 6 out of the 7 matrix for reopening our economy, with our hospitalization now low enough. And this can't happen without our incredible work from our Department of Health and our residents being good New Yorkers and helping us flatten the curve through social distancing and staying home. And I want to thank my staff that's been working on our plan for reopening, which is done, but now I'm just getting sign off from the other counties. It is written, and they're changing what they need to change in their respective counties. And hopefully we can get that to the control room by tomorrow. I'm hoping once we get the sign off from the other counties, because again, this is a regional approach. I know Saratoga has their own committee that they're looking how to open up. They got different issues than we do up north. They got the racetracks, they got racinos, they rely heavily on the tourist business. So I get that, but we have to do this together. We have to do this as a group. This is how it was set up, people. I didn't say this is how we're going to do it. This was way above us, and the governor came up with a great plan, him and his team, with their great leadership, and we can do this, and we're going to do it together safely. And I want to make this clear. We got a lot of questions back. We're not going to open up if it's not safe. In the control room, and a lot of guidance from Dr. Whalen and her staff at the health department, if the numbers start to go up, I hate to say it, we'll start to shut down again. So if as we start to get into phase 1, will we be ready by Friday? We may, but I don't think so. But one of the questions I asked yesterday was, if we do meet that first, not on the 15th, but if we meet it by the 16th, 17th, or 18th, can we open at that time, or do we have to wait to the whole 2 weeks? They said no. The minute that you meet it, you can open up, and which is great. So that was a question Steve McLaughlin and I had. That, well, okay. So if we don't get it by Friday and we get it by Monday, we can start to open up phase 1. Yes. Because I got to remind people, phase 2 doesn't start to June 2nd. And then phase 3, some there, don't hold me to the numbers, and like June 15th will be the next phase, the third phase. So we have to meet this matrix so we can start to. But I will assure everyone that's out there that if I see a safety or health issue or our death rate goes up, I will recommend to the governor in the control room we shut down. Because it is about the people that I represent and making sure we do this in a safe way. And that means everyone that's home keeping your social distance when we reopen. So I do want to thank the control room for their leadership yesterday. They answered a ton of questions that we had the day before. It was a productive phone conversation. We're going to have another one at 1400 hours every day to talk about this going forward. And I do want to thank General Murphy and his team and Joe Rubito and all them that were on that call answering them questions and helping us with guidance that we're going to need to reopen and do it in a safe way, and the governor, as always, for his leadership. So I do want to say thank you to everybody. Dr. Whalen.
Good morning. So we are seeing our numbers go down in terms of new cases diagnosed each day, which is encouraging. We are seeing low rates of hospitalizations, and this indicates to me that what we have been doing has flattened the curve. The policies around social distancing, staying at home, wearing masks are working. What it's important to remember as we go forward and look at how we reopen as a society is that it's unlikely that this is happening because coronavirus is going away. It is unlikely that COVID will go away until we have a safe, effective, and widely available vaccination. And this is many months away. So the responsibility for the public as we reopen is as important as it's ever been to continue to use the practices of social distancing within the agencies that will be opened. And we'll be giving some more guidance on that as we move forward. People need to know that as we open, it is likely that we will see cases start to increase. What we want to guide against is spikes that will be difficult to manage. And so from our perspective, from an epidemiologic perspective, from a public health perspective, we will be continuing to actively monitor where cases are occurring and making sure that we implement measures to stop outbreaks in their tracks through the practices that we have employed through contact tracing, through isolation, through quarantine. Those practices will be our major weapons going forward as we reopen society. So it's very important for the public to be aware of the fact that because our cases are down does not mean COVID is gone. We still need to protect ourselves. We still need to protect ourselves as we re-enter society in a responsible way. So as we do this, we'll be talking a lot more about the importance of these mitigation strategies that we will continue to employ, and we will really need the cooperation of every single member of the county as we move forward so that we can continue to move forward and that we don't face the situation, as the county executive just talked about, that we have to go backward. So your participation, your responsibility, your behavior is going to be essential to us being able to go forward. Thanks.
Thank you, Dr. Whalen, as always. And again, it's up to you people out there how we're going to do this going forward. And I said this a couple times, said it, felt like last week, it might have been 2 weeks ago, could have been yesterday. We do have to reimagine what things are going to look like from not just restaurants and schools and businesses, but how the outside world's going to look like. And we can only get there with your help in doing the right things. And I when I was driving around, I do see some people now that don't have the mask on. They think they're okay. Please, wearing the mask keeps you from spreading it. And if you're in a group and someone doesn't have it on, well, guess what? They're only hurting the people around them, not themselves. So keep that in mind. But that being said, I want to start by thanking our frontline workers, as always, our healthcare and EMS professionals, but this is National Police Week, so thank you to all the members of law enforcement for the job you're doing day in and day out, especially now during this crisis. Thank you. As always, we have the mental health line number opened up 7 days a week, 8 a.m. to 8 p.m. The number is up, as always, 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. And as always, our 211 number in the New York State hotline. Again, I want to say thank you to everybody. Thank you, thank you, thank you.